Good afternoon. My name is Debbie Schumacher, and I am a member of VCU Health's marketing team. Today, I'm joined with Dr. Amanda Ritter, who will discuss what pregnant individuals can expect through pregnancy and birth during COVID-19 times. We know pregnancy is an exciting time, and it's an amazing experience. But we also know it can be a little stressful, and we want to reduce some of that stress today by sharing how VCU Health is prepared to still empower you to have the birthing experience you want, and what we're doing to help keep you and your baby safe during this pandemic. Please note that we will hold questions till the end, but please leave them in the comment section and we will get to them. I'd now like to just give you a brief introduction about Dr. Ritter. Dr. Ritter is a general obstetrician and gynecologist here at VCU Health. She grew up in Eden, North Carolina, and received her Bachelor of Science degree of biochemistry at Washington and Lee University, and her medical degree at VCU Medical College of Virginia. Upon completion of her OBGYN residency at VCU Health, she joined our team as an assistant professor in 2016. Dr. Ritter provides the full spectrum of care, including low intervention birth, reproductive health, and minimally invasive surgery. She is a board certified fellow of the American College of Obstetricians and Gynecologists, and in her spare time, Dr. Ritter enjoys spending time with her husband and her two young sons, traveling and glamping in her family's camper. Welcome, Dr. Ritter. Thank you for joining us today. I will now turn it over to you.
Thank you, Debbie. I'm very happy to talk to all of you here today. Obviously, with this being a virtual event, I have no idea the number of people I'm talking to, but welcome, everybody. So just as Debbie discussed here, or introduced, I will be talking about pregnancy and childbirth during COVID-19. And I definitely want to reiterate the fact that this is a really, really exciting time for you, for your families. And even though we're in a pandemic, that doesn't take away that excitement. And we at VCU Health want to experience that with you. So today, again, I hope this talk will provide some reassurance for you. I'm going to go through what prenatal care during the COVID-19 pandemic looks like here at VCU Health, as well as a glimpse into the labor and delivery experience. I'm also going to talk a little bit about the facts about COVID-19, as well as the vaccine, which clearly is a hot topic these days. With that, I'll touch on pregnancy and lactation in regards to the vaccine, and then I'll close at least my part of the talk with why I chose to get vaccinated. So in regards to COVID-19 and pregnancy, there are no major concerns with conception and pregnancy during the pandemic, which is a good thing. We do know that symptomatic pregnant women with COVID-19 are at an increased risk of more severe illness compared to their counterparts who are not pregnant. And with that, for women who are symptomatic with COVID-19, there can be an increased risk for hospital admission, as well as ICU admission or need for ventilator support. But the good thing is that the absolute risk of severe COVID-19 infection is overall low. And so that in itself is reassuring. We do know so far that pregnant patients that do have certain comorbidities, in particular obesity and diabetes, do have an overall higher risk of severe illness than other pregnant individuals who don't have these comorbidities. So certainly during the pandemic, but even before the COVID-19 pandemic, and certainly hereafter, we want you to know that our number one priority here at VCU Health is the health and safety of you and your baby. We are here to give you a happy, healthy pregnancy and delivery, regardless of a pandemic or not. So pardon the selfie here, but in terms of prenatal care at VCU Health, what we are encouraging is a combination of both virtual and in-person visits. So when a woman calls our office with a positive home pregnancy test, she is typically given a virtual initial OB appointment. And at that visit, the decision point can be made as to when to obtain the first ultrasound for viability, based on potential bleeding issues or any discrepancies in dating. So that initial visit can dictate when the next or the initial ultrasound is. But in general, we are encouraging the visits to be in person when there's lab work or an ultrasound or an exam that is indicated. So with that, that's generally around the 12-week visit. And if genetic screening is desired, it can be done at the same time. At 20 weeks, when we do the anatomy ultrasound, at 28 weeks, when we do the glucola for gestational diabetes screening, as well as the Tdap vaccine and other blood work. And then also at 36 weeks, when we do the Group B strep swab, so that warrants an exam or at least the test in the office, and also can confirm that your baby is head down. The other visits in between, we're encouraging to be virtual if appropriate, but that decision can certainly be made between you and your provider. Regardless, we are here, and if there's an issue that arises at any point during the pregnancy where you do need to come in, we are here and we have providers who are ready to help you. When you do have a virtual visit, that visit is done via an app called Doximity. And the good thing about that is that it does not require you to have any sort of specific phone. It does require that you have a functional camera. And if for whatever reason you don't, we certainly can conduct the visits over the phone if absolutely needed. But with the Doximity app, at the time of your appointment, you will receive a text. And within that text is a link that you click, and it will connect you directly to your provider. Alternatively, when we are doing in-person visits, you will generally get a phone call a day or two in advance to confirm that you do not have any signs or symptoms of COVID-19. And then when you arrive on campus, you will have your temperature checked at the entrance. And we do ask that you wear a mask anytime that you're on the hospital property. And also, anytime you're outside of your home is a good practice in the setting of this pandemic. So when you come up to our check-in area, our waiting rooms these days often have minimal to no people. And that's certainly not because we aren't taking care of patients. We certainly are taking care of patients, but we are making a great effort to minimize any potential additional people in communal areas. So when you check in for your visit, you are taken back to an exam room as quickly as we can in order to prevent you from having to wait in a waiting room. You'll then wait in that exam room for your provider to come see you. So once you've gone throughout your pregnancy and it's time for labor and delivery, the one thing that I really do want to reiterate is that certainly there are things that are different about care during the pandemic, but what is the same is that you will still receive the same superb care that you would have, or that you did receive prior to the pandemic. Some of you may be having your second or third or more pregnancies and have received care with us previously. So I want you to rest assured that the care is still just as great as it was prior to the pandemic. We also still have the same infrastructure of providers. So we still have the full team of OBGYNs. We still have our midwives. We still have full anesthesia capability. We have our NICU staff available at all times, just as before. We have our same postpartum nursing staff and support, and even still have our lactation consultants. So the same providers are still available even during the pandemic. Now, certainly there are things that are different about the pandemic or with care during the pandemic. And so certainly we are all wearing face masks and face shields. So this is a picture that I took last week on call. So we all come into the room with all of this garb on. So for our patients who have a scheduled procedure, whether that's an induction or a C-section or some other procedure on labor and delivery, we are asking those patients to obtain a COVID test within 48 hours of their scheduled procedure. That test is done on labor and delivery and does not require an appointment. And then you would come to labor and delivery for your scheduled procedure thereafter. If you come into labor and delivery in labor, somewhere where you could not anticipate that happening, then you would have a COVID test done at the time of admission. And also another thing that I really do want to emphasize is our visitor policy. We do allow one support person and one doula if you do desire a doula. Not every hospital allows doulas at this point, but we value them as a very important part of our team. And so we, regardless, allow the one support person, but also allow a doula if you desire. We definitely still want you to have the same support. So now we'll transition a little bit to the COVID-19 vaccine, which clearly is a very hot topic these days. So the vaccine itself is extremely safe. It has been studied in over 30,000 individuals prior to being available. It's a lot of people. Now, it was not studied in pregnant women or breastfeeding individuals, but it certainly has been studied at length in those other populations. It is extremely effective. It is 94 to 95% effective after the second dose, it's incredible. Just for a comparison, the CDC, the Centers for Disease Control, has published data on the flu vaccine over the last decade or more. And from looking through the efficacy of the flu vaccine over the last decade, the highest effective rate I could see was around 60%, and the average being around 30 to 40 or 50%. So this COVID-19 vaccine is extremely effective. Now, definitely the vaccine is made in a different manner than the flu vaccine, but I just want you to get a sense of the efficacy. And I also want to iterate that I do recommend the flu vaccine as well. So the COVID-19 vaccine is a 2-dose series. So there's the Pfizer vaccine and the Moderna vaccine. The Pfizer vaccine is given to individuals who are age 16 or older, and is the 2 doses that are given 21 days apart. The Moderna vaccine, on the other hand, is given to individuals, or can be administered to individuals who are 18 years of age or older, and the 2 doses are given 28 days apart. The COVID-19 vaccine is an mRNA vaccine, so it does not change your DNA. It does not change your genetic makeup, and it is certainly not a live virus. So many of you may be aware that ACOG, which is the American College of Obstetrics and Gynecology, it's the national organization that provides guidance and recommendations for obstetricians and gynecologists, as well as other women's health providers. This organization put out a practice advisory in December of 2020 in regards to vaccinating pregnant and lactating patients, specifically for COVID-19. It's a well-written document, and if you haven't read it already, I certainly would encourage you to take a look at it. You can go to the website, which is ACOG.org. It's certainly something that is a good idea to take a look at, and many of you, like I said, probably already have. So in regards to whether or not, or if you are trying to conceive, so you're not yet pregnant but are attempting to do so, ACOG does recommend that you receive the COVID-19 vaccine. As far as we know, there's no known risk of infertility, miscarriage, or harm to the fetus in this setting. If you receive the vaccine and then discover that you're pregnant between the first and the second dose, ACOG does recommend that the second vaccine be given on schedule. There's no need to check a pregnancy test before receiving the vaccine, and there's no need to have a discussion with an OBGYN in regards to receiving the vaccine in terms of permission. That being said, we are happy to discuss it with you. So if you do want to discuss it, we are here and we are happy to do so, but it's not a requirement if you know that you want the vaccine. So again, this is probably what most of you have tuned into this for in regards to the COVID-19 vaccine and in regards to pregnancy and lactation. I will say I don't have any inside information here, but according to ACOG and that practice advisory, they do recommend or make a statement that COVID-19 vaccine should not be withheld from pregnant individuals who meet criteria for the vaccination. So if you're pregnant and you fall into the criteria for someone who can receive the vaccine, you want it, you can have it. Otherwise, in terms of lactating individuals, the ACOG practice advisory states that the vaccine should be offered to lactating individuals, similarly to non-lactating individuals who meet the criteria for receiving the vaccine. For women who are breastfeeding or who are interested in breastfeeding, there's no need to avoid initiation of breastfeeding or to stop breastfeeding in order to receive the vaccine. So with all of this, I encourage you to talk to your OBGYN, your midwife, nurse practitioner, whomever your women's health care provider or your provider of your prenatal care is, if you have questions. This certainly can be a very individualized decision. I've probably had this discussion at least 3 or 4 times, most days of the week for the last several weeks. And each situation is different in that there's different aspects to consider, and it is a very, very individualized choice. Regardless of what your choice is, we support you in that decision. We do want to make sure that if you want to talk about it, that you have that opportunity, but regardless, we support your decision. So pardon the selfies again. I don't generally take many selfies, but I guess you wouldn't know that from listening to this talk. But these pictures were taken right after I got the vaccines. The one on the left was the first one, and the one on the right was the second vaccine when I got my official sticker that I completed the vaccine. So there's certainly smiles behind those masks. And for me, getting the vaccine was a very easy decision, and I feel very fortunate to be able to receive the vaccine. My husband and I both work in healthcare, and we have a pretty high risk of exposure on a daily basis. And so for me, it was an easy decision in terms of protecting myself, but more so protecting my family, my colleagues, my patients. Also, I'm still breastfeeding my youngest son. We'll just do a picture from the side there. And while there's no data yet on the potential transmission of antibodies for breast milk after receiving the COVID-19 vaccine, anything I can do to have the remote possibility to provide any sort of benefit to my youngest son is priceless to me. So this vaccine is certainly a light at a very, very long tunnel. So with that, I'd like to thank all of you for joining Debbie and I today. I know this has been a really hard past 10 or more months, but we at VCU Health are here to take care of you, to answer your questions, to support you, and we look forward to the return of normalcy someday, hopefully sometime soon. Until then, I encourage you to please stay vigilant with wearing your mask, washing your hands, staying socially distanced, so that one day we can all see each other in person, maybe even without a mask on. So, thank you.
Great. Thank you, Dr. Ritter, for that informative and insightful presentation. If you'd like to learn more about pregnancy and birth at VCU Health, please click on the links in the comment section below. You can download a guide and learn more information. You can take a virtual tour of our labor and delivery unit, or you can also make an appointment with one of our providers. Once again, the links are in the comment section. We'll now open the floor to questions We did receive some questions ahead of this webinar, so we'll also be addressing them, as well as any questions that are in the comment section. We can go now to questions. Dr. Ritter, if I am COVID-19 positive, can I pass the virus to my baby?
So if anyone has COVID-19, there certainly is the potential to pass the virus. With that, we would certainly recommend that a COVID-19 positive mom wear a mask, wash her hands, but it's not a requirement that we separate the mom and the baby.
Great, thank you. Are pregnant people eligible for the vaccine here in Virginia?
So currently pregnant women fall in the 1C category in terms of high-risk individuals. With potential vaccine shortages arising, these pregnant women certainly can be eligible for the vaccine if they meet criteria otherwise. We are not yet administering the vaccine to our pregnant women at VCU Health who are not healthcare providers within the system.
Let's see. Here's another question. Do I need to delay getting pregnant until I get both doses of the vaccine?
So you don't need to delay getting pregnant. If you have received the first vaccine and if you become pregnant during that time frame, then you certainly should receive the second vaccine.
Okay.
And if you're trying to conceive and are not yet pregnant, then you should definitely, it is recommended to receive the vaccine if offered.
What are the side effects from the vaccine?
So in terms of side effects, there certainly can be soreness at the site of the vaccine or the site of the injection. With the second dose, there's been reports of headaches, fatigue, muscle aches, chills, fevers, and again, soreness at the site of the injection. But all of these are a very, very small price to pay relative to potentially getting the COVID-19 vaccine. And these are all very short, limited symptoms. They typically resolve spontaneously within 48 hours.
Good to know. And here's another one. After I get the vaccine, do I have to continue to wear a face mask or practice social distancing?
You certainly should. It's still recommended that anyone who still gets the vaccine should still practice social distancing and should still wear a face mask. There's still not data quite yet in terms of whether or not individuals who are vaccinated could potentially transmit the COVID-19 virus. So until then, until enough people in our population have received the vaccine, we're still encouraging everybody to wear a face mask and practice social distancing.
Great. And I just want to go back. One question I've heard a lot is around breastfeeding. If you are breastfeeding, is it safe to get the vaccine? And is it safe to breastfeed after the vaccine? I know that you are doing that, but could you share any other advice that you have?
Certainly. So again, we don't have data yet in terms of the COVID-19 vaccine in lactating individuals, but there's no reason to believe that what we do know that there should be any adverse side effects or effects in lactating individuals and their babies. It is safe to breastfeed after getting the vaccine. I did so.
Great. Well, thank you. And are there any other questions that you hear from any of your patients that you want to address? Or have we covered most of them?
I think we've pretty much covered most of the questions today.
Great. Well, pleasure. Dr. Ritter, thank you for your time. Oh, I see one more question is coming in. You can't leave quite yet. Are there resources or data for similar vaccines? And what is the risk to unborn babies?
So in terms of resources, the Centers for Disease Control, or the CDC, is a fantastic resource. Also ACOG, with that practice advisory that I mentioned earlier in the talk. So go to acog.org, and that practice advisory is an extremely well-written resource. It actually was updated just last night. In terms of similar vaccines, the mRNA vaccine itself, this technology is not new, but the COVID-19 vaccine is the first vaccine of its kind to be administered. So I'm not sure what other potential data would be out there in terms of similar mRNA vaccines. But again, the CDC is a very, very reputable source.
Okay. And it looks like there are no more questions. So thank you for joining us. I'm glad we were able to learn more about how to have a safe and healthy pregnancy and delivery here at VCU Health and during the pandemic in general. Thank you for sharing all the recommendations around the vaccine, because I know there is a lot of questions around that. And now we're over. So thank you very much, Dr. Ritter, and thank you to everyone who joined us. Have a great day.
Thank you very much.